Hey everybody, I almost forgot to hit the right button. Hi there everyone. Welcome to CaringKind Live, CaringKind's weekly live stream. Today is Wednesday, August 26th at 1 o'clock in the afternoon in beautiful New York City. I am broadcasting from CaringKind's official broadcast studio here in my apartment in Queens. Thank you so much for visiting. We have a great show for you tonight, today. It is 1 o'clock in the afternoon, so not nighttime just yet. We're going to do this live stream in two parts today. One part is highlights of the week, all of the news associated with Alzheimer's and dementia caregiving, as well as CaringKind. And we are going to have a really interesting interview with Dr. Alisa Kauffman, whose specialty includes treating patients with Alzheimer's and dementia. We're going to talk about the New York Times article about gum disease and Alzheimer's that was in the New York Times just a few weeks ago. So thank you again for joining us. We have a lot to cover today. And remember, you can always like, comment, subscribe on this video if it's in YouTube or on Facebook. If you could please like and share in our content, that's really helpful, because the more that you like and comment, the more our message amplifies and the more people see our message and can get the help that they need if they need it. So we're on all the social media platforms that you want to be on: YouTube, LinkedIn, Twitter, Instagram, Facebook, you name it, we're there. And so please follow, like, subscribe. And if you have any questions about the show today, feel free to leave a comment. We can interact live as it's happening. So please leave a comment. Just so you know, today's interview with Dr. Kauffman was pre-recorded because she couldn't make it on the Wednesday afternoon, but we wanted to make sure to get her on the live stream. So her portion's pre-recorded, but feel free to ask a question and I will make sure that she sees it and answers you after the fact. Okay, so let's start with the highlights of the week, shall we? And that means that we're going to turn that off and start with CaringKind. I've got too many of these. CaringKind highlights. All right, first highlight of the week is New York Times articles all week this week. The New York Times had an article about COVID-19 and nursing homes, an unprecedented effort to stop the coronavirus in nursing homes. Really interesting article about a drug that they're testing in order to protect nursing home residents, which, as you know, have a disproportionate are disproportionately affected by COVID-19 more than anyone else. Again, if you're interested in this article, be sure to check out the actual link to the article in the See More section under this YouTube or Facebook video. Another article in New York Times is Alzheimer's and virtual reality. A new company by Embodied Labs in California, headed by Carrie Shaw, has a new virtual reality program that allows people to experience what life is like with people, for people who have Alzheimer's and dementia. So it really helps people understand what the disease is like, and it really helps create empathy for people who are suffering from the disease. And that's a really interesting article, and it would be interesting to experience that. So check out that article as well. We have one more New York Times article, and that was from a few weeks ago. This is the article that we're going to talk to Dr. Kauffman about. So if you haven't checked that out already, make sure you do that. And that's the CaringKind Alzheimer's and Dementia Caregiving in the News. Now, what else do we have going on? Well, we have a lot going on. We have education highlights. We've got two brand new virtual seminars, which are part of our monthly education seminars. This one is about placing your relative in a nursing home, and it's a very complicated process. So a lot of people have questions about that. So that's on September 14th from 6 to 8 p.m. If you want to register for that, register by calling our helpline, or you can register online. The link to that registration is in the show notes to this video. That's placing your relative in a nursing home. The other monthly education seminar we've got this month is navigating the Medicaid home care system. Again, Medicaid is complicated, and you would be well advised to get some information before trying to go down that road. So please check that out as well. That is September 2nd from 2 to 3:30. You can't just show up. You have to register in advance. So make sure that you call our helpline or you register using the link that is in this show description of this video. And of course, all of our monthly education meetings are on our website. So if you just go to CaringKindNYC.org, you will see the programs and services, and you'll see monthly education seminars. And all of the seminars are posted for the month of September. And that includes everything from Medicaid to Medicare, legal, financial, and understanding dementia, as well as a few more, including the ones we just talked about. So that's what's going on in terms of education seminars from us here at CaringKind. Now, we've also got 3 other special events coming up in September and October. The first one I mentioned on the last live stream, which is the Lorraine Halis lecture. That's on September 16th. This is an annual event that we do where we bring in all sorts of people to talk about the projects that they've worked on. This one is about a book called Creative Care, Transforming How We View Dementia Care. So we're going to be talking to the author about that topic, and it's going to be super interesting. Again, you can't just show up. You have to register by calling our helpline. Again, the link to our helpline is in the show description of this video. That's September 16th. And of course, we have our walk coming up October 11th. It's going to happen. It's a hybrid event this year, both online and in the real world. The day is, it's going to be a great day for from 9:30 in the morning till 3 o'clock in the afternoon. We're going to start off with an opening ceremony in the morning. We're going to ask people to wear their walk shirts and walk in their neighborhoods. You're going to walk in your neighborhood. And then we're going to have you come back at 1 o'clock in the afternoon, and we have an afternoon full of programming online. That programming includes virtual tables that hosted by CaringKind staff, virtual tables hosted by our sponsors, partners, and tech fair participants. And what that means is, if you're a virtual table, it means it's going to be a link to a Zoom video, basically. And you'll be able to interact with CaringKind staff, partners, and sponsors so that we and they can talk to you about anything you want to talk about related to their topic. So that's going to be one element in the afternoon. Another element is going to be a panel discussion virtually with 4 panelists talking about caregiving amid COVID-19. How has it changed? What do you do? How do you approach nursing homes in a different way than we did before? All the topics associated with COVID-19 and caregiving will be covered in that 30 to 35-minute panel. And then we're going to close the walk this year with something really fun, something we've never done before, and that's going to be a concert. David Hyde Pierce and friends are going to, and 4 of his friends are going to sing songs as a way to show gratitude for all of our walkers who are participating in this year's walk. So, so please make sure you register for the walk. And that's coming up in October. So as you can see, we have a lot going on, from all the education seminars to the walk and the Lorraine House lecture, and we have our annual gala as well. The Forget Me Not Gala is October 26th, about 2 weeks after the walk. And again, it's virtual, so you can register for that by contacting our helpline. So gala, walk, Lorraine Halis lecture, September education seminars. Your calendar is booked. So so make sure you check out all of that stuff and do what's right for you. One last thing I'm going to say about the walk, and that is we have a new explainer video. You know, one of the things that I've learned after doing the walk for last year is that our fundraising system can be a little bit confusing, whether it's confusion with regard to the registration process or confusion with regard to how to manage your page. How do I upload a photo? How do I customize my URL? How do I tell my story? How do I share? All of that stuff, it can be very complicated. So we've created 2 explainer videos, and by we, I mean me, on my little laptop. And I've created 2 explainer videos to walk you through the process very clearly about how to register and how to optimize your fundraising page. In fact, maybe I can show you just a little bit of that right now. And if you notice, I have a little injury. I hope you had a better week than I did. I have a little case of the carpal tunnel syndrome because I've been working on my laptop like this for the past 6 months. So I'm going to show you just a little bit of this, how to optimize your fundraising page so you can get a feel for what we have to offer. So I'm going to share my screen right now, and we're going to check this out. How to optimize, share my audio. Now check this out. There we go. This tutorial is for walkers who have already created their fundraising page. If you haven't yet registered for the walk, then please watch the previous tutorial called How to Register for the Walk. You can find that video on CaringKind's Walk page. If you have created your walk page, nice work. In this tutorial, you'll learn how to optimize your page by uploading a profile image, customizing your page's URL so people know that your link is legit, and I'll just go to your profile or settings, and lastly, go to your fundraising page or team page. Our first goal is to upload a profile photo. So go to fundraising page. At the top of your fundraising page, you'll notice. So there you go. That is just a little snippet of the new explainer video that walks you through step by step how to register your fundraising page and also how to optimize your fundraising page with pictures and videos and customized links and all of that stuff. So be sure to check that out. So those are all the highlights that we have for you this week. The next portion of this live stream is going to be pre-recorded, but it's a conversation I had with Dr. Alisa Kauffman, whose specialty includes people with Alzheimer's and dementia. So that is going to come up right next. If you have any questions or comments, feel free to leave them right now in the comment section of your YouTube page or your Facebook page, and I will respond as we go. With that being said, please welcome Dr. Alisa Kauffman. And here's our conversation from just a few days ago. Oops. And that did not work. So we'll try it one more time. There we go. Dr. Kauffman, good to see you. Thanks for being here.
My pleasure.
So the New York Times article on gum disease and Alzheimer's, what did you think about it?
Well, it's a very relevant topic for me as a dentist, and as a dentist who only treats the elderly and frail who are bedbound. Mm-hmm. When I treat my patients with Alzheimer's disease or the many types of dementias, I'm always conducting my own research. I'm always looking in their mouths and saying, wow, they have really bad teeth, or wow, they have really good teeth with dementia. So it's always like my own research. It's really important to me that the medical profession has finally and seriously taking a look at the link between the oral bacteria and how that may negatively affect and cause issues to an individual's health and well-being. There's millions of types of bacteria in the mouth. So many of them are good and some of them are bad, but certain spirochetes, those are bad bacteria, and they can travel along the trigeminal nerve that connects mucous membranes of the mouth to the brain, and this can cause brain damage, and that brain damage may be what dementia is all about. We know dementias are caused by inflammation. So there must be a link between gum inflammation leading to cardiovascular disease or diabetes. And these are known factors for dementia. So there's got to be a link.
Right.
And the author of that New York Times article, Ryan Demmer, he said, and I quote, "We haven't proven causation, but if it is causal, the impact could be significant. A half of the population has periodontal disease, severe enough to put them at a higher risk." So obviously, we know there is some sort of relationship, but we're not 100% sure about that relationship yet.
Yeah, yeah. I've heard over the years the connection between oral health and your brain and your heart. And it's a real connection, even though in our minds we think they're not connected. But if you have any kind of mouth disease, it can impact heart and brain and other parts of your body, right?
Exactly. You know, it's funny, but I'll see 109-year-old patients with dentures with every brain cell, like completely like you and I talking, like no dementia, nothing.
Right.
And I'll ask them, when did you get dentures? And they'll sometimes say, I was young, I was 60. And then I wonder in my head, wow, I wonder it's because they have no gum disease because they have no teeth, that they have no dementia.
Interesting.
And then I'll see patients more frequently that have really bad teeth, really bad gum disease with dementia. And as I said before, I conduct my own research and I wonder, where is that link and why aren't we really doing something about it? I mean, I know that my parents who are in their early 80s, they have all of their teeth and they floss every day because I'm a dentist. But I have this theory that there's the inflammation. I mean, think about it. It's in your mouth and then it travels other places. What kind of damage is it doing? We don't know.
Yeah.
We can only surmise that it's doing some sort of damage.
And how did you get into this field, right? Because, you know, general dentistry is one thing, but focusing in a specialty on people with Alzheimer's and dementia is very, very specialized. How did that come about?
Well, when I was at UPenn many, many years ago, because I've been practicing for 35 years.
Wow.
I know. We couldn't have our 35th year reunion, unfortunately, because of COVID.
Yeah.
But yeah, this was my 35th reunion year. I was always really good at dentures, which is kind of like being really good at something that's really nerdy. Nobody wanted to do dentures. Everyone wanted to do cosmetic dentistry and, you know, big crown and bridge cases. And I wanted to do dentures. So, you know, obviously my friends always made fun of me, but somebody has to do it, right? And when I started my own practice, because in the 80s, it really was not easy for women dentists to get good jobs. So I started my own practice almost right away. And I kind of always chose to work on that population of people. So if I did a great denture for Mrs. Smith, she told all her friends about me and I was soon the dentist.
Yeah, I hope that you pop
it only became obvious to me that
check
this
out all the
niche
links
was so important when my best friend's father had a stroke and he couldn't get to the dentist. And I said, well, I could go to him. And that led to this
Thank you so much for popping
ringing bell in my ear saying, well, you know, other people must need this service. I mean, what do people do when they have a toothache and they can't get out of their bed? Right. And what makes this niche practice so specialized is that I don't have a van. I don't drive around in a van like, you know, people say they're a mobile dentist, but they don't actually go into the homes. I go into the homes and other dentists that are, I'm trying to increase my network, and I'm very excited to say that we now have New York, Manhattan, Riverdale, the Hamptons, Nassau County, Queens, and Western Suffolk County, New York, and Chicago, soon to be Philadelphia, and Essex and Bergen counties, New Jersey. So all of these people have joined my network. And when you click on geriatric house call dentistry and you're in one of those areas, you're lucky enough to get a great dentist, because all of the people who are joining my network, they're all people who have been really well trained in this very specialized field. And I absolutely love what I do. Love, love, love. Hopefully people will see this and call me and say, I want to do what you're doing, because that's what this is all about. It's my mission in life that every part of the country has someone like me to help their grandmother and grandfather when they're in need. Obviously, going to the dentist is better. always. If you can get to your dental office, you don't need me. But if you need me, there should be more people doing this type of service.
Yeah, yeah. And so talk about that work. You know, what is the most common adjustment that you've had to make serving this very special group of people in a logistical way? How have you had to change a practice compared to a person who doesn't have Alzheimer's?
Well, I think in the beginning, what I needed to do was figure out what equipment I needed, consolidate it into boxes so that every patient, you knew what procedure you're doing. You just take that part of the equipment with you. I use very small, adaptable equipment. Like sometimes you could plug in your curing light. Well, I have the best curing light that has a charging stand. So it goes into my bag. I have portable Profi, Bluetooth equipment. I have a new Genere X-ray that I finally found something that is portable, 3.3 pounds, and it sends an image directly to my cell phone. So there's no computer necessary. I mean, I wrote a book, How to Become a House Call Dentist. I'm lecturing to different schools right now. It's scary, people that start doing this, they're scared of making a mistake, but basically you limit the amount of things you do in the home. You're not doing root canals, you're not doing crown and bridge, you're not making people's teeth whiter. When people ask me to make their teeth whiter, I literally laugh. I'm like, no, that's not my job.
So when it comes to a person with Alzheimer's, how have you had to, how do you approach it? Because it's got to be a stressful experience for a person with Alzheimer's and dementia. And when a person without dementia is stressed, you can give them Novocaine, you can give them laughing gas, but that might not be possible. I'm not sure. So how do you adjust the actual? How do you work with a person with dementia?
I do a lot of lying.
Mm-hmm.
I tell them that I am their daughter, whose name is X dentist, and that I know that you have a toothache and I'm here to help you. And your daughter only trusts me, or son, or whatever it is, and we're going to get this done. I have special mouth props that I'm using that are made of foam, and I have developed a whole product line that is on its way to being design patented, and I'm looking to actually make this bite block even easier for dentists to use, because one of the reasons why no one wants to treat these dementia patients are they don't open, and when they do open, you got to watch your fingers. 35 years, no one has ever bitten me to the point where I couldn't grab my finger out or basically get nipped. And I had my fingernail cracked in half in October by a dementia patient, not because I did anything wrong, but his wife was holding the foam block in the mouth, and he went, ugh, and she pulled it out, and he just, like a dog, grabbed onto my finger and didn't let go.
Yeah.
I worked the rest of the day, and then I had my finger surgerized. But you got to do what you got to do in this field. But I think that there's so many ways that you can deal with it, and you do give them anesthesia, but you don't give them the traditional anesthesia where you get to the whole half of the mouth numb. You only make the tooth numb that you're working on. Mm-hmm. You use very, very small 27 gauge extra short needles, and you give them a special injection that only gets that one tooth numb, which is great because you don't want to make an older person numb. How sometimes you get your whole side of your face numb from a block. I don't do blocks, and I teach not to do blocks. Mm-hmm. So the one thing that I always tell the new dentists that are joining, and the people that have joined are already house call dentists. We're just joining forces, which is great to have that camaraderie. But the one thing I always tell them is, your limitations. If you think you can't do it in the home, you don't start doing it in the home, and you send them either to the emergency room where they bring a dentist in and they sedate them, or you have a relationship with your oral surgeon, and they have to get out. If you can't do it in the home safely, they have to get out.
Right. Now, and you're not only working with the person with dementia, you're also working with their caregiver, which adds another level of anxiety and complication for you, right? Because not only you're managing the patient, you're managing the caregiver, and you don't know how they're going to react to a given procedure. Talk about that.
Well, many times I have to take out a tooth. I'll ask the caregiver to leave because they look like they're going to faint. Mm-hmm. So I don't need to take care of two people, and that happens a lot. So basically, there's a lot of trust involved going into the home. Obviously, I would never go dressed like this. I wear a uniform with my name and ID. And, you know, when they ask me all kinds of questions, like, I need you to give me a reference on you before I allow you in my home. That's a common thing. But the most difficult part usually is dealing with the caregiver, because they're always afraid that something may happen. But I mean, if they're in a dental office, something may happen. So basically, knowing your limitations, being very calm, being very nice, lying as much as possible. I mean, okay, fibbing, I hate the word lying, but if I tell you how many times I have to tell them that I am their child's dentist and that's why I'm here. And
Well,
even with,
right, and that's you know, CaringKind, you know, when you work with a person with Alzheimer's and dementia, for those who might not know, you know, you never challenge a person's understanding of the current situation they're in, right? So if it's in the middle of the day and they think it's night, you agree with them. If it's beautiful outside but they think it's raining, then you agree with them that it's raining. So you say lie, but in fact you're agreeing with their reality. And that's actually the right thing to do. You don't want to challenge a person with dementia on the logic because they're not at that place. You want to agree with their reality. And if their reality is that you're their beautiful daughter, well, then you're their beautiful daughter. And that makes the procedure easier for everyone. Right?
Exactly.
Yeah.
I mean, my job is challenging, but I think that's what I love about it so much, you know, just figuring it out, you know, figure out how to make it work. And I mean, I have to tell you, I've had a lot of funny stories in my life while I'm practicing. I've seen everything. And it's the most exciting part of the job, actually, like walking into an unknown and getting it done and leaving and feeling good about yourself. I worked on a woman 2 days ago, coolest apartment downtown, Greenwich Village, you know, dressed like a hippie, 80-something years old. Her bridge fell out. And I had to figure it out because the tooth broke, one of the teeth connected to the bridge. So I had to take the bridge apart and take the tooth out. And she's like, I cannot believe you just did this in a half an hour in my house.
Yeah.
And I said, what part of it can't you believe? She goes, well, at my regular dentist, this definitely would have been at least 2 hours. So, you know, it was just funny all around, you know, because I move fast. I have to talk slow. You know, and then the other thing, the best part of that story was the husband who had Alzheimer's disease. She did not. He was eating. He didn't say one word. His caregiver was sitting there, adorable caregiver. And he just looked up and said to her, Joan, did you ask this woman how many years she practices? She looks like she just got out of dental school. And I said, oh my God, you just made my day. No one's ever said anything so nice to me.
That's wonderful. What a good moment.
Yeah.
What a good moment. You know, we've got to wrap up in just a minute, but before we do, what would be your advice? You know, if you were to meet a caregiver who has to deal with some dental or issue or oral surgery issue, what advice would you give caregivers about taking care of the oral health of the person they're caring for?
I will tell them that those little pink sponges that they give you in the hospital and what they think is an effective method of cleaning the mouth is literally like wiping the mouth with a sponge. You're just smearing the bacteria everywhere. Don't be afraid to see blood. Use a toothbrush with a little toothpaste on it and really clean between the teeth and under the gums as much as possible. And, you know, don't be afraid to reach out and ask for advice either from your own dentist or, you know, even if you call me on the phone and you're out of my geographical area, I'm always happy to look at a picture of what you think is a big deal issue or might not be a big deal issue. But never just leave the mouth alone because you see some blood. Always clean the teeth twice a day and have them drink a lot of water so that the bacteria doesn't just lay on the teeth.
Good advice. Dr. Alisa Kauffman, thank you so much for joining us on the live stream.
Thank you for having me.
You're welcome. Sorry, muted. Okay, that was my conversation with Dr. Alisa Kauffman, not Alyssa. I mispronounced it at that time. If you have a question about dentistry or oral health at all for a person with Alzheimer's and dementia, check out Dr. Kauffman's website in the show description of this video. That wraps it up for this week's live stream. My name is Chris Doucette. I am here at the CaringKind Studios every week, Wednesday, 1 o'clock in the afternoon in New York City. Please check us out on social media. If you like this video on Facebook or YouTube, please like it, share it, and make comments on it. The more people who watch, like, and share our content, the more our message amplifies, and the more people who need our support get our support. So until next Wednesday,